I see that Melvina is on.
Hi, do you hear me?
Yes, we hear you now, Melvina. That's great.
Okay. All right, I'll start my presentation now.
Okay.
Good morning, everybody. It's Melvina Opshawn. I'm the HR advisor for Northern Intertribal Health Authority. I'd like to thank Kara Gray Eyes for having this wonderful forum on an annual basis. It sure brings a lot of information for our career seekers and job seekers, etc. I will be delivering on the Northern Intertribal Health Authority. Again, I'm the HR advisor here. We are a unique organization in Saskatchewan. We are the only health authority, First Nation health authority in Canada, but there is also another BC First Nation Health Authority, but it's actually run within the First Nations Indian Health Benefits. But we solely run Northern Intertribal Health Authority. Without further ado, this is our presentation. So, as I mentioned, Northern Intertribal Health Authority provides
Melvina,
third-level support.
Melvina, can you turn on your camera? We can't see you.
Oh,
or were you wanting to share your presentation?
Yes. Just wait here.
Oh, okay.
Just wait. Okay. There. There, I got the video on.
There, we can see you. We can see you.
Okay, now I'll do the share screen. Now I'll go there. Okay, as I mentioned, I'll go back to the beginning here. There we are. And I was discussing, we are Northern Intertribal Health Authority. We provide third-level support services to our partners. We have 4 partners, which consist of Prince Albert Grand Council, Meadow Lake Tribal Council, Ballantyne Cree Nation, and Lac La Ronge Indian bands. Currently, our workforce at Northern Tribal Council is 34 full-time employees. We do have some term employees just because of our COVID situation right now. We are always looking for new recruits because there are some people are either moving on or retiring. So our vision is partners communities will achieve improved quality health and well-being with their community members empowered to be responsible for health. The NITHA Partnership of First Nations-driven organization is a source of collective expertise and culturally based cutting-edge professional practices for Northern Health Services in our partner organizations. Before 1990, all health services were actually administered by First Nations Indian Health Branch, and then they did a devolution in the early 1990s, and in 1994, First Nations Indian Health Benefits transfer responsibility of community health services, first level, and supervisory support services to second level to First Nations organizations. As mentioned, we have 4 partners. Meadow Lake Tribal Council got their devolution in 1991. Prince Albert Grand Council in 1992, Lac La Ronge Band in 1993, Ballantyne Cree Nation in 1995. They realized that they couldn't do all the services, so they joined together, and that's where NITHA was born. NITHA was born in 1998 under a unanimous membership agreement. And in 2004, First Nations Indian Health Benefits recognized NITHA as an organization to provide the funding to continue moving forward. We provide services to 33 First Nations. Ballantyne Cree Nation consists of 7 First Nations here. Meadow Lake Tribal Council consists of 9. Prince Albert Council consists of 11 First Nations, and Lac La Ronge 7 First Nations. With the Ballantyne Cree Nation, all their communities are at least 400 kilometers from Prince Albert and at least 200 kilometers from a hospital setting. With the Prince Albert Grand Council, they only have 1 fly-in and 9 community, approximately 120 kilometers to 350 kilometers from Prince Albert. Lac La Ronge Indian bands their communities are approximately 120 kilometers from a hospital setting. In Meadow Lake Tribal Council, their communities are approximately 120 kilometers to 400 kilometers from a hospital setting. So as you can see, which is the reason why we have our health agency here. The services we provide are community health health nursing programs, primary care nursing, home and community care programs, mental health and addictions program, dental health programs, administration, including finance, human resources and management, and numerous support programs. We serve a population of about 61,521 people, and on reserve population is 32,859. This is our flow chart here on our levels of service. NITHA is the third level advisory service to 4 partners: public health services and community services. Then the second level health services are Prince Albert Grand Council health managers, MLTC, Ronge, Peter Ballantyne Cree Nation health managers, and the nurse managers. And then the first level is the First Nation communities, community health nurses, RNs, and RN nurse practitioners. Our key programs provide consultation and direction on public health issues such as communicable disease, including STIs, TB, vaccine preventable disease, and endemic disease such as salmonellosis. Promote population health approaches through health promotion, tobacco control, environmental health, infection control, and immunization. Provide consultation on programming for program areas in nursing, mental health and addictions, emergency response, e-health, IT, privacy, and capacity development. In our public health unit, we have 4 core functions that we address: public health assessment, health promotion, health protection, health promotion, disease and injury prevention, surveillance, and we also do development of health policy and protocols to help with our First Nations. In our public health unit, we have a medical officer, a public health manager, an epidemiologist, public health nurse specialist, CDC nurse, infection control advisor, health promotion advisors, environmental health advisor, HIV project coordinator, TB advisors, 3 TB nurses, research assistants, 2 program administrative assistants, and practicum students. Our community service units, we provide program support and services to second level managers in the partnership, achieved through working groups, which is hosted quarterly, and at these meetings, partnerships identify their needs and we create an action plan so we can address the needs. All communities can send a representative to the working group in order for NITHA to obtain the needs and as for accountability and transparency purposes. Staff are also present at the partners and regional and national tables to ensure their voices are heard, and they are also on the leading edge of new initiatives. Our community service unit manpower consists of manager of community services, nursing program advisor, tobacco project coordinator, mental health and addictions advisor, emergency response coordinator, e-health advisor, information technology support, help desk support, 2 program administrative assistants. In our administration unit, we have the executive director, the executive assistant, finance manager, personnel finance assistant, communications officer, reception office assistants, and a human resource advisor. This is our organizational chart, so you can see that the board of chiefs, which consists of our 4 partners, are at the top, and we get all their direction from our partnership chiefs. And then it's taken to the executive council. The executive council consists of the 4 First Nations health managers, and then it flows down to the executive director. We also provide a scholarship. The deadline is every year on September 30th, and we provide scholarships of up to $3,000. Students can reapply on an annual basis. You can actually access our application on www.nitha.com, or you can request by emailing receptionist@nitha.com. The guidelines and the application are all on our website. I encourage everybody to visit our website to learn more about NITHA and what types of services that we provide. This is our mailing address, Box 787, Prince Albert, Saskatchewan. We are located right on the Peter Ballantyne Cree Nation Urban Reserve in Prince Albert. So our physical address is Chief Joe Custard Reserve, 201 Peter Ballantyne Cree Nation Office Complex. And Tara Campbell is our executive director. So if you wanted, we have all of this contact information on our website also. Thank you for listening to our Northern Intertribal Health Authority. I also suggest that If people are interested in our health careers, they should go and access the Relevance magazine. It does indicate the career progression in getting into nursing or any type of healthcare professional career. Thank you for your time.
Thank you, Malvina. It's Kara here. Does anybody have any questions for Malvina?